good afternoon, good evening, and good morning, everyone. We'll give people a minute or two to join. As you can see, the number of participants is increasing progressively. I'll speak a little bit slowly to allow people to join. So my name is Antonio Harden. I'm a child psychiatrist here at Stanford. As you all know, we've been putting together webinars for Ukraine under the Stanford Autism project for Ukraine. We've had 3 or 4 lectures so far. The first one was on PTSD and anxiety in typically developing children. The second one was on psychopharmacology. The third one was on assessment of kids with autism. The last one was on anxiety in children with autism. And today, I am honored to introduce our guest speakers, and the topic of the presentation is pivotal response treatment strategies for children with autism spectrum. We have Dr. Grace Jangu, who's a clinical professor here at Stanford University, accompanied by Maria Stefan Milan, who has a master's in science and our expert clinician in pivotal response treatment. And also there will be help with Catherine Paycheck, who has a master's in arts, who's part of our research team. The presentation, including the question and answer, will last for about 1.5 hours. And after the presentation, within a few days, we will have a recording in English, in Ukrainian, and in Russian will be posted on our website. I'm gonna send right now the website where people can go and look at the previous lectures and also look at the schedule for the next lectures. If you have any questions, just a reminder to use the question and answer tab, because the speaker will be monitoring the Q&A tab more so than the chat tab. And without further ado, I introduce you to Dr. Jangu, Stefania, and Catherine.
Thank you very much, Dr. Harden. It's a pleasure to be here with all of you. And what we're planning to do today is to talk a little bit about a type of autism treatment that we focus on in our research and our clinical work at Stanford. We're hoping to share with you a little bit of research and a lot of practical strategies that can be helpful for motivating children with autism and other developmental and behavioral disorders. So whether you're a parent or a clinician working with children, I hope some of the things that we'll talk about today will be useful to you. On the next slide, I'll outline our plan, our agenda for today. I'm going to start by talking briefly about kind of some of the background behind the technique pivotal response treatment, so that anybody on the call who isn't already familiar with this type of treatment can kind of place this in the big sea of autism treatments that you already know about. I'll also talk briefly about some of the research support that, or some of the recent research that Dr. Harden and our team at Stanford has completed over the last few years, so you can have a little taste of the data supporting this type of therapy. And then I'll turn it over to my colleague, Catherine, who will share with you the format that we use when we teach parents how to do PRT. So you can see the structured way that we organize the treatment over a 12-week period if we're working with a family on a weekly basis. And then she will also talk about how we structure learning opportunities, what we call the ABCs of PRT, which she'll explain how we set up the context, what we call the antecedent before we teach, and how we make sure that the consequence or the rewards after a child does the behavior, how we make sure those are in place to motivate the child. And finally, I'll turn it over to my colleague, Estefania Milan, who will go through some great examples of how the 6 core motivational strategies of PRT can be applied to motivate young children. So she'll give you examples of how to create opportunities in the natural environment, sort of whatever is going on, whatever the child is interested in. Hopefully some of those techniques will be useful to you. Now, moving to the next slide, I'll make a few comments, and we can advance this, yes. I'll make a few comments about early intervention for children with autism in general. So we have a lot of different types of treatments that we can do with young children. And you might be familiar with different philosophies or different theories of the best kind of treatment. I like to organize my decision-making with these 3 questions. So I urge you, as you're listening to me, to think about the treatments that you deliver or the treatments that you are familiar with, and think about where they fall on this continuum. First question is, who is the leader? Who is in charge of this treatment? Who is making the decisions about what the child is supposed to learn? And if you look on the left-hand side here with this mother teaching a child about a turtle with a flashcard, you can see that this is an example of a mother who has decided that she is going to teach her child about a turtle. And so this is an example of a parent or an adult being the leader of the treatment. Now, we can also do treatment in the opposite way. We can follow what the child is inherently interested in. And instead of the adult deciding that today we're going to learn about turtles, we can wait until the child is having an experience right there in the moment, and then use that as an opportunity to teach the child right then and there. So some treatments are very structured and adult directed, and other treatments are very child directed. Both types work, but there are major advantages when we follow the child's interest in the moment, because the motivation will be much stronger. The second question we ask ourselves is, where does the teaching occur? Now, we can sit a child at a table in a clinic or a classroom away from everybody else in their life and do the teaching in a very contained environment, or we can do the teaching in the natural environment, out in the yard, in the kitchen, in the living room, in the bathtub, anywhere the child is located. And although this kind of teaching in a structured environment away from everyone else can work, there are major advantages to doing teaching right where the child is, whatever it is the child is doing that day and that moment. The third question we could ask ourselves is, what is the goal of the treatment? Sometimes we want a child to learn simple cognitive or academic tasks. We want the child to learn the difference between blue and red. We want them to learn their letters. We want them to learn very discrete skills. But a lot of times what we really care about long-term is relationships. And it's much more important that the child have a connection with the person that they are interacting with. And so these treatments that focus on the child's interests implemented in the natural environment and focus most on relationships and connection with other people are the types of treatments that have a major benefit in terms, that's okay, we can go to the next slide, in terms of the child's motivation. And pivotal response treatment is one of these types of naturalistic developmental behavioral interventions, the kinds that focus on the child's interests in natural environments and focus on relationship development as a major priority. Now, for those, you may know of other naturalistic developmental behavioral interventions as well, and PRT is just one example, but it uses the principles of applied behavior analysis. We have good science to suggest that ABA is a useful and effective treatment for children with autism, but at the same time, it incorporates a developmental perspective using the child's interest and their level of development to inform the treatment. And finally, it's implemented in the natural environment wherever the child is at the time. For background, PRT is an evidence-based and manualized treatment. It has been identified as one of the comprehensive models of treatment for several decades. And in the most recent national standards project in the US in 2015, was identified as one of 14 established treatments for autism. On the next slide, I'll explain how why it's called pivotal. So the term pivotal is because we are looking for target behaviors that we can work on that will not just improve the one behavior we are treating, but will result in improvements in untargeted areas, so broad aspects of treatment. We have a few choices when we do treatment. We can break the necessary skills down into very small components and try to teach one behavior at a time, but that's a very slow way for a child to make progress. Or we can focus on pivotal behaviors where we have a theory that improvement in one area will result in collateral or extra improvements in all sorts of other untargeted areas. And in PRT, the primary area that we choose to focus on, the primary pivotal area, is motivation. And the reason is that we've found through research that when children with autism are motivated, they are capable of many, many more accomplishments. And so if we can tap into their motivation, we actually can see improvements in engagement, in eye contact, in joint attention, in lots of extra skills that we might not even teach directly. And this focus on motivation is especially important because, as you know, many individuals with autism find social interaction to be not very motivating, or it can be a core deficit, and we can't necessarily count on the motivation that typically developing children have for social interaction. On the next slide, I'll show you a glimpse of a study that we published, myself and Dr. Hardin and our colleagues published a few years ago, where we compared the teaching of parents how to do PRT with participation in a psychoeducation group that was focused on general autism topics, but didn't specifically teach PRT. And we wanted to know if the parents could learn in a 12-week group format, if they could learn how to implement PRT. And the graph on the left shows you that at baseline, the two groups were about equivalent in their PRT, what we call fidelity of implementation, how accurately they were delivering PRT. And the blue group, the PRT group, made a significant improvement after just 12 weeks, one session per week of group parent training. they learned to implement PRT above the 80% fidelity criteria. So they successfully learned to implement PRT accurately after just 12 weeks of treatment. And that was really good news. What was even better news is that when the parents learned to implement the PRT, on the graph on the right side, you can see that by 6 weeks, and then also by 12 weeks, the children were making more utterances. They were speaking more during videotaped interactions with their parents. So we were very encouraged to see that just once a week, teaching parents to implement PRT in a group resulted in an improvement in the children's talking, how much they were able to talk in their interactions with their parents. We went on the next slide to do a second study, which we published a couple of years ago, which another randomized controlled trial, where this time we did a little bit more intensive treatment over a little bit longer period of time. So this was 2 to 5-year-old children with autism and significant language delay, and they were randomized to get a package treatment. So a combination of the weekly parent training for the first 12 weeks and then monthly parent training for another 12 weeks, plus 10 hours per week of a therapist going to the home and delivering PRT. That lasted for 12 weeks, and then about 5 hours per week for the next 12 weeks. So we wanted to see if adding therapist implementation of the PRT at home would help the children make even more improvements. And we were comparing this again to a delayed treatment group where the children were continuing with stable community-based treatments. Here's a graph where you can see in the red the PRT package group, and we're measuring utterances, the frequency of utterances in 10-minute parent-child interaction videos. And at 12 weeks, you can see a significant difference between these two groups, where the PRT group is talking a lot more already after just the 12 weeks. And this continues in the week 24, still a difference between these two groups. And again, in this study, about 91% of the parents met the PRT fidelity of implementation at 12 weeks, at 24 weeks. Moving to the next slide, I'll show you an additional measure that we tried out with this study. This is a measure called the BOSC, the Brief Observation of Social Communication Change. And it's a new measure designed to be sensitive enough to track changes in core autism symptoms through clinical trials. So a decrease in the BOSC score indicates an improvement in core autism symptoms. So in the red, you can see that at 12 weeks, and then especially at 24 weeks, the children in the PRT group showed less severe autism symptoms over 24 weeks. And it's maybe concerning to see that the children in the delayed treatment group who were receiving treatment, their autism symptoms were pretty stable over the whole 6-month period. And this gave us a lot of hope that the PRT, it looks like it's not just improving communication skills, but also improving core autism symptoms, core social deficits during the parent-child interactions. So we're really pleased to see that when parents implement PRT, the children, number one, they improve in how much they're able to talk, but number two, there seem to be improving, their autism symptoms are getting less severe. On the next slide, I'll give you a little glimpse of some of the treatment research that we're doing in our autism and developmental disorders research program. You have the website here in case you want to check it out. We have 3 active trials relevant to these little kids, this population. We have a neuroimaging trial led by Dr. Hardin, where we're trying to discover what are some of the brain-based predictors, structural neuroimaging and DTI at baseline, to understand who responds best to PRT, and can we predict that from neuroimaging at baseline, as well as track any changes in the brain that might happen after 16 weeks of PRT. We have a second trial where we have a center-based early intervention program delivering PRT to children in the clinic, where we're looking to see who will benefit from the delivery, not in the home, but in the clinic, and trying to pilot some novel computer vision technology for detecting symptoms and progress. And finally, we're doing a telehealth parent training trial open to families in the US and in Canada, where we are testing out how effective the PRT parent training is when delivered virtually via Zoom sessions, secure Zoom sessions with a therapist. And now what I'll do is turn it to the next slide and turn it over to my colleague, Catherine, who can give you a little glimpse of when we do these research trials in PRT, or when we bring parents in for PRT parent training in the clinic, how we structure the systematic kind of progressive learning, so that hopefully by the end of 12 weeks, the parents will meet fidelity and be able to implement PRT accurately. Thanks, Catherine.
Thank you. So to start, you can see our outline week to week. And at first you can see the first session is parent only. So this is kind of similar to today's webinar, where we discuss what PRT is and the different principles that we'll be learning through the following weeks. And then after that, the sessions become with parent and child, where we're focusing on the first 10 minutes, teaching different PRT principles, and then applying them throughout the session and doing a live feedback parent-child interaction where we're applying that principle. Also with each week, there is a homework worksheet that we send parents with. And during the beginning of the following sessions, we review how practice went that week. And we review those homework questions to see if there's anything that we might be able to problem solve during our live direct sessions. On the next slide, you'll notice that there are 2 sessions where it's just parent only towards week 9 and week 11. And these are really great sessions where we do a video review. So during those weeks, we have the parent videotape about 10 minutes of themselves playing at home, doing PRT with their child. And then we review our fidelity of implementation scoring sheet. And this is the fidelity of implementation scoring sheet we use across therapists, parents, any kind of clinician to measure how well we're applying these PRT principles. And these sessions, I think, reference really well into the research that Dr. Jean-Gu showed, where we saw 91% of parents doing PRT fidelity at week 24. And so this has been really helpful for parents because we can we track together how well they're doing these PRT principles. And also it's just really great because a lot of parents see that they're doing PRT as well as a therapist might be doing PRT. The next slide jumps into our ABCs, as Dr. Jean-Gu mentioned, of PRT. So PRT is using an antecedent behavior consequence model, which is what is used to help us understand and change behavior. So all applied behavior analysis programs use a similar ABC model to promote learning. And with PRT, when focusing on language, we apply that to those opportunities. So we can see here Our antecedent is our first thing. It describes what's happening before we have the target behavior occurring. And during our antecedent, this includes our prompt, where we are prompting our child to communicate. So in this case, we see in our example, car, or what do you want, or just having a car as our antecedent. So in the next, what follows our antecedent is our behavior, and this is our child's response. And then we have our consequence, and this is what we're providing the child, and this is our reinforcement that follows directly after we see our target behavior. So in this example, we see the antecedent as car, the child responds with car, and we give them the car. So in PRT, the consequence is often a natural reinforcer that is contingent on the child's response. Another important thing to note here when using PRT and when we're creating opportunities, we're always assessing, as you can see in this yellow bubble, if the child is motivated, and determining how we can gain access to shared control of the reinforcement of the consequence. So what we recommend when we're initially starting out with parents and providing parent training is to observe the child and join in their play, and looking at their body language to follow their lead towards activities that they're interested in. So this relates well to the example that Dr. Zhanggu used with the turtle. The child showed us that he was interested in the turtle, he had the turtle, and then we would try to see how we can get shared control of the turtle and what might be the appropriate question or prompt or antecedent to teach the behavior that we'd like to hear and see. During the next slide, yes, we'll go deeper into antecedents. And so when we're thinking about antecedents, depending on the language level of the child, we can adjust our prompt. And we have 4 different ways that we provide opportunities for language. The first is our model prompt, where the child is directly imitating the words or the questions and the comments we're saying. So this is our example of us saying car. Or if a child finished a puzzle, our comment that we use a model prompt for might be, we made a race car puzzle. The next kind of prompt we use is an open-ended question. So this is our question of, what do you want? And the child target behavior expected from this prompt is an answer to this question. Another kind of prompt that we can use and that we use is a nonverbal prompt, or what we call a time delay. So this is when we have a car and we don't say anything, and the child responds to us holding that car to get access to the car. And then we also have spontaneous initiations. And so this is when the child is responding to those natural opportunities for communicating. And these are created in our natural environment. So we'll go in this presentation into different ways that we can set up our environment to create those natural opportunities. But some strategies here that we like to talk about is one, that time delay, and then also anticipating the child's needs but not acting. And this is hard because we know we're really great at anticipating what our child might want in an opportunity, and sometimes we just jump in and provide it. But in PRT, we want to take a little bit of a step back and know that he may want that car, but not giving it to him until we get that behavior of saying car before he says car. We also break up different activities so that we have those natural opportunities for children to request for more. If we're building a puzzle, we don't give all the puzzle pieces at once, but we give one puzzle piece at a time. So we have multiple opportunities for them to say puzzle or piece. Another strategy for creating opportunities for spontaneous initiation is doing things a little bit differently. We call this surprises and breaking up routines. Rather than putting the car on the car ramp the right way, maybe we put it on upside down. So the child can say, flip the car or car down the ramp. This is also kind of playing the naive adult, forgetting certain different things when during a bedtime routine. Oh, we maybe forgot his stuffy or his favorite book that he likes to sleep with. And we can prompt there for them to request for their favorite stuffy because we forgot. We go into this a little bit more deeply within the rest of the presentation, but those are just some ways that we can create those opportunities in the environment for this spontaneous initiation. Next is our B, our child response. So this is any verbal communication made in response to those presented opportunity. Depending on the level of the child's and where we're at in treatment, these communicative behaviors can look differently. And the behavior can start by looking like a direct imitation of the model prompt. It can also be any kind of verbal attempt to a nonverbal prompt. And then it can also be those spontaneous initiations and that spontaneous language that we're reinforcing during opportunities. Our C is our consequence. And so our consequence is directly what follows the behavior that will increase the probability that that behavior will happen again. So there are two different kinds of reinforcers that we think about. Like in our example with the car, we have a positive reinforcer. So this is giving access to the desired item or an activity or a favorite food. And then we have a negative reinforcer, which means that we're avoiding an undesired activity or an outcome. So this is an opportunity when we might hear a child requesting all done, or I don't want to do that. It's still reinforcing to remove things at certain times, but in PRT, we do like to focus on using those positive reinforcers whenever possible and kind of adding to the play and giving those desired activities and outcomes that the child wants to see. These positive reinforcers lend themselves really well to those spontaneous initiations because we see that motivation increased, and that's why we use those positive reinforcers whenever we can. Next, Estefania is going to introduce 6 individually validated motivational techniques that help us focus on that yellow bubble of increasing motivation. And these have been really well researched and mapped onto this ABC model to enhance motivation in children.
Thank you, Catherine. Okay, let's see. So just like Catherine was saying, we have this ABC structure, which we have to have in mind every time we set up a learning opportunity. And we have 6 individually validated variables that have shown to increase motivation for learning. And I do point out that the 6 have been individually validated, which means that each one was researched on their own, using clear prompts, shared control, following the child's lead, etc. And then what the creators of PRT did was put them together and map them onto the antecedent and onto the consequence, calling this a motivational package. So the idea is that we use these 6 motivational variables every time we set up a learning opportunity. So I'm going to go over each one of these, but it's nice to, first of all, notice how we have attention in clear prompts mapped onto the antecedent, meaning our prompt has to be clear. When we prompt, we have to make sure we're following the child's lead and we have shared control and we're varying the tasks. And I'll talk a little bit in more detail about what task variation means. We then expect our child to respond verbally. These are all the examples I'll go into for learning purposes are about expressive language. I'm sorry, my mouse is acting out a little bit today. So, okay, there we go. And then we deliver the reinforcer, which always has to be contingent upon the child's behavior. We're using direct and natural reinforcers. Again, this is why PRT is called a naturalistic intervention. We do always provide natural reinforcers, and we're working within the natural environment. And we will always be reinforcing attempts. Again, this is to enhance our child's motivation to respond. Okay, so again, talking about the antecedent, the first thing we have to have in mind when we place a prompt, when we place a demand for our child to respond, is to make sure we have our child's attention. This will save you lots of time and effort if we make sure we have our child's attention before we prompt. We actually do not want to use a prompt to call their attention, which is sometimes things we tend to do. What do you want? Come over here, right? We actually are going to observe first, see what our child is attending to. If our child, let's say, is playing with a car and he's attending to the car, then I know that I have his attention and what he wants. That's when I'm going to give him the prompt, okay? And the prompt we're going to deliver has to be clear. It has to be appropriate to the task, and it has to be uninterrupted. So depending where our child is at with their language development, we will use single word model prompts. For example, just saying car and waiting for our child to respond verbally and say either the word car or make any attempt, even a sound, if that's where our child is at with initial sounds or initial words. Or we can even give them a more complex model prompt if our child is at the point where they're combining multiple words. Something like, I want the black Batmobile. This is a Batmobile, right? So it's very specific. So if our child is already at that level, I can still prompt a very complex request, but just make sure that you're very clear. So you're really saying what you want your child to say. So we want to use simple language and be at their eye level. This helps when we're working, playing with them, be sitting on the floor with them, even sometimes lying down, because it's always easier to look either straight or down rather than have to look up to pay attention. Again, it has to be appropriate to the task. I'm not going to ask him, what's your name, to give him the car, because there's no direct relationship between answering that social question and giving them the car. And again, it has to be uninterrupted. We have to make sure there's nothing between the prompt and the reinforcer. And again, this increases the likelihood of their motivation to continue working. The fact that we're using clear prompts and our child really knows what they have to say in order to get what they want. This is the really important thing about the clarity of the prompt. It's really clear for them what they have to do in order to get what they want. And again, we can have a little bit more complex prompts like open-ended question. Again, we're going to ask an open-ended question when we know the child knows the answer. So that this, again, is a little bit more complex, but if my child is really familiar with the word car, then I can ask, I can ask him, what do you want? Again, it's very obvious. I'm holding the car. He wants to get the car. So I ask that open-ended question, or I can use a time delay, but just holding the car and looking at him with this look on my face, right? It's very clear that he's expected to respond in order to get that car. So here are some examples of sessions we've had of how we can use clear prompts. One thing that's very important when we are thinking what we're going to prompt, and again, I always tell parents and therapists, take your time to really figure out what the child is motivated by, because that's what we want to use for prompt. I have this really nice example of, during the pandemic that we were doing telehealth and we were working with the families in their home. Most of them tended to have these wipes, right? The disinfecting wipes. They were, the hot commodity we were all looking for in grocery stores, right? So child was playing in his playroom, and then he actually wandered towards the disinfecting wipes. Dad was doing a great job following his lead, so they were playing with a marble run. But then when he saw the child grab the wipes, he decided to go with the wipes. So he was doing a great job following the child's lead. And then what's a great example about this is that with one reinforcer, he was able to use different prompts. Why was he able to do this? Because he paid really good attention to what the child wanted to do in each one of the instances. So first the child grabbed the wipes, right? So dad said box, because they were in a box, and child said box, and then he gave him the box. There's where you have your first A, B, C. Child got reinforced. And then the child wanted to open the wipes, but they were more tightly closed than mine today. So then dad put his hand over the lid and said, open, and child said, open. So then dad opened the wipes for him. Then the child was trying to pull out a wipe that was sort of locked. And then dad said, pull, and child said, pull, and dad pulled out the wipe. And once the child had the wipe in his hands, he started rubbing it and getting all that soap out of it. And so again, dad was very quick at that point. I think we were already in session 10. So he was doing a great job. And dad grabbed a wipe himself and started rubbing his hands. And then he looked at his son and said, clean. And his son said, clean. And he went ahead and cleaned his son's hands. So this is a great example of how he used clear prompts for each one of the instances that the child wanted, with just using one reinforcer, just using this, box. The dad was able to prompt many different things. And this actually makes the learning meaningful, because the child was actually understanding how each word was related to something different within that activity, right? And also sort of on the same note, just like we have this little girl playing with mom on the bed, that's definitely something that we use a lot for PRT. Any sensory social activities. These are things kids tend to love and really enjoy doing. So again, depending on what the child is motivated by, is what we're going to prompt. I had a little boy who loved jumping on the bed and then loved being thrown back on the pillows. So mom would prompt jump, jump, jump. Child would respond each time. She was holding his hand. So there's a shared control. She was holding him. She said jump. He would say jump, and he would jump up. And then she would notice that this child would start sort of pulling back. And that's when she would say blast off, and the child would say blast off. And she pulled him against the pillows, and he would crash on the bed, and he would really enjoy it. So again, the clarity of the prompt depends on what we notice that is the motivating part of the activity. And that's how we know exactly what we want to prompt. And this makes the learning more meaningful, because they actually can relate the meaning of that word to that consequence. And again, here in this example with the blocks, we could be prompting something like build if the child is just interested in building, or we could be prompting something more specific like blue block or big orange block, depending on which block the child wants. Once we realize, then we can start adding what's called multiple cues. We can start adding those descriptors like blue block versus big orange block. Again, when the child is at a level where we can add multiple words, then we're going to make it more complex so the child can be more specific in their requests, right? And we have the other little girl who's actually seems to be enjoying the lights that are coming out of the blocks. So we could be prompting something like look at lights, and the child says look at lights. So if you're blocking the block that has those lights, we could say look at the lights, and the child says look at the lights, and then I move my hands so that she can enjoy the lights that are coming out of the blocks. So thinking onto the consequences, C, right? Here's another one of the motivational variables that Catherine already talked about, is the contingency of the reinforcer. We have to make sure that the reinforcer is contingent upon the child's behavior. What does this mean? If the child engages in the desired behavior, if he responds verbally, he will get that desired outcome. He will get the car, the block, to look at the lights, to open the box of wipes. But if they do not engage in the desired behavior, they don't get this desired outcome. We withhold it, right? And why is this important? Again, this makes the learning clear. he actually gets a message, okay, this is what I need to do to get what I want. If I am contingent sometimes and I am not contingent the other times, if I'm inconsistent, then the child really will not know what he needs to do in order to get what he wants, right? And the other thing related to the contingency is the immediacy of the reinforcer. The reinforcer has to come right after the behavior, because we are reinforcing whatever occurred in the past 10 seconds. So if I say something like, oh, do you want to play with cars? And the child says, yes, I want to play with cars. And then I have to go into the playroom, get the box, open the box, bring out the cars, then that's way too long of a wait to get the reinforcer. So there's not that direct relationship between his behavior and the reinforcer. So we have to have the reinforcer ready and available to deliver it right away, okay? And again, we have to be consistent, because contingency some of the time does not work. Consistency is the key, and be sure you can follow through. What I always tell the parents is be careful with what you prompt, because you have to be sure that you can follow through. You know, an example I always use for this is prompting for dinner. Probably you don't want to prompt for dinner, because if your child doesn't respond, rice, then you'll have to just, you know, put the rice away, because we're, again, being contingent. Again, this little boy that I was working with, dad said, oh, you know, it's going great. We're doing PRT and dinner. And I'm like, how is that going? So I always hesitate. He said, it's actually going great, because he loves rice. So he will always say rice. And if he doesn't say, it's fine, because he eats rice every day. He will have whatever else is on the table. So, you know, be careful with what you prompt. I always joke, don't prompt for the veggies, because if he doesn't say broccoli, then you'll have to put the broccoli away. And as a parent, I know we always try to sneak those into dinner. So we can always prompt for snacks. For example, our kids can live without snacks. So, but probably we don't want to prompt for dinner. Just be mindful that when you prompt for something, you are able to follow through. Or another example I really like, is that sometimes, and this is a good problem to have when kids, you know, when you're being really consistent in doing your PRT, you'll start having another problem, is that children will start requesting tons of things on their own. So another child I was working with, it was hard to get started, having a hard time finding things that were motivating him. We were working with Catherine together, and he was really fond of ice cream. So we said with mom, if you're fine, we can try it, right? We were first or second session, and mom brought out the ice cream, and that's when he got it. He actually had a lot of language, but wasn't using it very functionally. So then when mom brought out the ice cream and said ice cream, he said ice cream right away, got a few spoons of ice cream. And then he started understanding, oh, I'm actually supposed to talk and repeat what she's saying to get what I want. So that actually got us over the first sort of hump of difficulty. And then mom told us, I think by session 6, she said, I have to tell you something. PRT is going really well, but what's not going well is that at 6:30, he's tapping me on my shoulder. And when I open my eyes in the morning, he's saying, ice cream. So we were sort of joking, saying, okay, this is a good problem to have. Don't worry, you did not prompt it at 6:30 in the morning, so you do not have to follow through. It's okay to say no ice cream, but just be careful, because if you do say it, then you'll have to follow through. So the other motivational variable related to the antecedent, again, that Catherine was talking about, that was in our yellow bubble, is child choice and shared control. So we are going to follow our child's lead, again, to enhance motivation. We are going to do PRT with things that your child is motivated by. Why? Again, Grace was saying, because children with autism are harder to motivate than other kids, and they don't have that same social motivation to please. So we do have to use this more, let's say, artificial way, in the sense that we are following their lead. We're not just sitting and saying, okay, today we're going to talk about colors, because that's not how they're learning, which is why we need to follow their lead to enhance their motivation, right? And again, how do we identify what they're motivated by? By observing. I always tell the parents, take your time, count to 5, and really sit back, stand back, and observe. Look at their body language. Once we identify what they're motivated by, that's when we can prompt, okay? So this, again, following the child's lead, it maximizes their engagement and increases the likelihood of generalization. Because if child is motivated by swing, and then we happen to have a swing where we're working, then that's what we're going to use PRT with. We're going to say swing, push high, and then it's more likely that he will generalize this to the swing in the park, to the swing at school, right? So it's really helpful to use things that he is motivated by and that he has in his natural environment. And again, we have to avoid placing demands until you're sure the child is motivated. So what we do at first is we call it enticing. It's okay to start playing, saying, oh, you know, I'm going to play with a marble run, and start throwing some marbles down the marble run, or start playing with cards and throw them down the ramp, just as long as you're not prompting. Then that with the moment we see that we have his attention, again, that the child is focusing on that right now, that's when we prompt, okay? And the other sort of aspect of, you know, child choice and shared control is that we also have part of, you know, the control in the sense that we have to have control of the reinforcer before giving the prompt. Again, if the child is already playing with a car and I say car, it's likely that he might not respond, because let's not forget that communication is hard for our kids, for the kids that we're working with, which is why they're not responding. So if I already gave him the car and he's happily playing, he probably will not respond. But if I'm holding that car that he wants, then he will respond. And that's when we can deliver the reinforcer, right? And the other thing about shared control is that I always say it's shared between the child and the parent, in the sense that we're following the child's lead. So that's where he has a little bit of control, because we're using what motivates him to work. But on the other hand, we can always also set the limits and redirect, just like the example of the ice cream at 6:30 in the morning. We can say, no, it's not time for ice cream, but there's where you can provide choices. We were telling mom, okay, let's think about 2 things he can have for breakfast, right? Maybe he can have those waffles and fruit. So you could respond, okay, we can't have ice cream, but you can choose waffles or fruit. So by providing choices, you give them a little bit of a sense of control, and you still have the outcome you want. Or for something, let's say like doing homework, maybe, you know, your child doesn't want to do homework, but you can tell them, okay, you can do the homework in the living room or in the kitchen, or you can do math first and English first. What would you like? And that gives them, again, a little bit of a sense of control, and it avoids unnecessary power struggles. And what are the strategies for gaining shared control? The first and easiest one, like I'm showing, is just holding the item, right? I'm holding the car, just say car, and the child says car, and I hand it to him, or I push it down the ramp, right? You can always interrupt what the child is doing. We can, you know, block the car, or, you know, we've played with trains a lot, right? You can just block the train and prompt for something like train go, or move hand, right? And the train keeps going. You can introduce a new item to the game. I have, again, a little boy that I'm working with, and he just loves playing hide and seek with dad on the bed. And since, again, there's just a certain amount of things we can prompt while they're playing on the bed, we said, okay, let's introduce his stuffies. So at first it was just dad hide, and dad would hide, and now we're hiding the alligator, and, you know, we introduced the shark, and he has lots of stuffed animal that he really likes. And then we actually started being more specific, and it was sort of an accident because we were playing hide and seek, again, under the covers. This was, again, via telehealth. So child was in his room, and dad's hand was hanging from the bed. And then the child noticed, and dad, again, was super quick to say, cover hand, and child had to cover hand. So then we became more specific in our prompts. So dad had the shared control in the sense that he could pull out his hand, and the child would say cover hand, and then he pulled out his foot, and child said cover foot, and then he would peek out with his head and prompt cover head, and child would say cover head. So he was introducing new variations to the game. And there we were able to vary our prompt. So we just started with play hide and seek or dad cover, and then we made it more specific, and we were working on, you know, covering the body parts, hiding the stuffed animals. Again, he was being the fun part of the game. With any of these sensory social routines, you can be the fun part of the game. You're the one that tickles them. You're the one that hides. You're the one that chases them. And you could say something like, chase me. And they say, chase me. And then you chase them around. And again, be flexible, okay, when you're following the child's lead. I have this picture of these cute guinea pigs. Again, I was working with a little girl. She was at home. We were doing telehealth, and she was usually motivated by tons of toys. But that day she was tired, just came back from school. And mom, she logged on and she said, I need to tell you, today is going to be hard because she just seems to be low energy, not very motivated. I have all the toys out there. She usually gravitates towards them, but she has no interest today. Said, okay, then again, let's practice observing. Let's take it slow, observe, follow her around, see what she's motivated by. And that's what we did for the first 5-ish minutes, which can be a lot when you're just, you know, following someone around. And then finally, you know, mom was just enticing her with different things. She wasn't responding. And so then until we got to her guinea pigs, I had never seen them. Like, oh, you have some guinea pigs. And mom says, yes. And then she actually, again, that's where her hand moved. Again, body language. We're observing her body language. And I said, oh, it seems like is it okay if she plays with them? She said, yeah, they're sweet. So then we prompted for her to say open cage. She said open cage, and then mom opened the cage. And then these cute guinea pigs had very funny names. So one was called Boba, like boba tea. So mom said, and mom was again quick there. She said boba, and the child said boba, and she brought out boba. And then the other one was called spinach. And then mom said spinach, and then she brought out spinach. And there we were playing with the guinea pigs. And again, we were thinking, okay, what else can we do? I asked mom, what else does she like to do with the guinea pigs? She likes to feed them. Okay. So then we went to the fridge. Mom got the carrots and she brought the bag. And again, that's where she was able to separate this activity, this simple activity of opening the bag and feeding the guinea pigs. She said, open, child said, open. And she said, carrot, child said, carrot. Then she said, feed spinach. And she would feed spinach and feed boba. So again, just be very flexible. We really can do PRT with anything our child is motivated by, okay? And then, like I was saying at the beginning, we're using direct and natural reinforcers. We are going to provide our child with a natural consequence for the demand you place. So this, like I said, makes the learning meaningful. This is also really important when we are at these first words level, because this actually helps them connect the word with the meaning, right? So we're also working on receptive language here. This is a question that we get a lot, especially when we're starting. Aren't we doing any receptive language tasks? That we are actually killing two birds with one stone here, because if we say car, child says car, and he gets the car, then he's also receptively learning, oh, okay, this is what this means. This word actually is related to this object, right? It makes the learning meaningful. So using this reinforcer that is directly related to the behavior also increases the learning and generalization skills to the natural environment. Like I was saying, if he says swing at home and gets on the swing, then if he says swing at school or at the park, it's highly likely that someone will understand him and be able to deliver that reinforcers, right? It also improves affect, because learning in the natural environment and using direct reinforcers is fun for the child and for the adult. And this is what we hear a lot from parents saying, oh, grandma was really surprised when when so-and-so went to their house and was able to, request juice when the fridge was open. Again, the fact that he was practicing that at home, getting that direct reinforcer, and then is able to generalize is great, because we see them engaging in those behaviors in other environments where they are commonly. It increases their willingness to engage. And again, we can do PRT anywhere. We could do PRT when we're walking with them to the park. We could be pausing and saying, go, we're pausing the scooter and they say go, and then we push them. We could, when we're working on multiple cues, again, we have to make sure that we have something that the child is really, let's say, motivated by, right? That's why when we're working on colors, I always tell the parents, okay, first, let's think, is there something that's really motivating for your child that has a specific color? And I always put the example of Lightning McQueen here, which is the main character of the movie Cars, which, was on the high rise of popularity some years ago. So that was how we were teaching red to many, many kids. The same as with Thomas the Train, that is blue, as many of you know. So when we have something that our child is really motivated by, so that our child actually cares that he gets a red car, that's Lightning McQueen, versus a blue car that we don't know who he is because he wasn't a main character, right? So that's when we're going to teach red car. And again, that's when he gets a direct and natural reinforcer of a car that's actually red. So they'll start paying more attention to those specific, let's say, describers, the specific attributes of that car. And again, for example, if we're wanting to teach big versus small, another good example is start with cookies. We have the mini Oreos and the regular size Oreos, and if you show them, do you want the big one or the small one? It's highly likely that they will go towards the big one, and that's when you will say big cookie. Again, give them that model prompt, and they will start paying attention to the fact that they're different sizes. So that's how we can teach big versus small. This natural reinforcer will actually teach them the meaning of that attribute, big versus small, red versus blue. I had a little boy that had milk in the morning and in the afternoon, but the morning milk had to be warm and the afternoon milk had to be cold. And that's how we actually taught him the difference between hot and cold, because he actually did care. So in the morning, mom on purpose would, the first time it would again be a model prompt to say warm milk, and he would get his warm milk until one day he got his milk cold, and when he grabbed it, he was playing a naive adult. He was sort of surprised, tried, and gave it back to mom, and then mom said, do you want warm milk or hot or cold milk? And he said warm milk, because he had already learned the difference, right? So this is how important the natural reinforcer is. It makes the learning meaningful. The other motivational variable related to the antecedent is the task variation. Again, this is related to the fact that we want to intersperse easy and hard tasks, because the easy demand builds motivation through a sense of mastery. If the child is able to respond to your prompt pretty quickly and it's something easy for him, then he will be more motivated to keep interacting with you and to keep responding. Again, this is a little bit of common sense here, thinking if I am set up to do something that I feel I have the skills to do, I will be more motivated to do it. If I wake up in the morning and suddenly I have to give a talk on algebra, I'll probably will not be very motivated. But if I have to talk about something that I love doing, like PRT, then I will be more motivated. Same with our children, right? If something is easy enough for them and they like to write and they're playing with something that they like, then they will be more motivated to respond. And we have to build this sense of mastery to create what's called a behavioral momentum. So we're saying car, they say car, we say go, they say go, we say push, they say push, they're responding and they're getting reinforced. And this builds what we call a momentum. We say, well, they're on a roll. And that's when we add in a hard task, an acquisition task that introduces the skills the child needs to learn. So I'm saying car, push, go, and then I pause and say, what do you want? And since it's an open-ended question, it's a little bit harder. That's an acquisition task. It shouldn't be too really far away from the difficulty of the acquisition task. It's just one step above. So we do plenty of maintenance tasks. It shouldn't be too far away from the maintenance task. We do plenty of maintenance tasks, and then we add an acquisition task. Then we continue doing plenty of maintenance tasks, and then do another acquisition task. Many parents ask about the ratio. And if you go to the manual, it actually says do 7 easy, every hard. So that seems a lot. And especially, the concern for some parents is, my child is already behind. Should I be spending so much time doing things he already knows? The answer is yes, because this builds motivation. Again, this is our primary goal, to motivate them to communicate, to motivate them to try, to motivate them to respond. And once we have that motivation through this sense of mastery that they can respond, that's when we can introduce and teach them new things. Okay. So again, variation can occur by changing the task, changing the target behaviors, and changing the environment. Like I said, it might be easier for the child to respond at home than when he's at grandma's, right? Because we change something in the environment, or when he's with peers. So if then our child is with peers, then we might make the task a little bit easier. So if we did another study with Dr. Jangu, where we were using PRT to prompt social initiation. So we had kids that had a lot of language and maybe were requesting to their parents saying, I want the blue car, please put it under the bed. But when they were playing with peers, we would maybe just use a model prompt, much simpler model prompt, like saying, I want the car. And then the peer would provide them the car, because initiating to a peer is harder. So we have to vary, again, we have to vary the difficulty if we do increase the complexity in the environment, for example, if they're initiating to a peer. And again, what has been shown in the research is that when we vary the easy tasks with a hard task, there's actually, the learning is more effective and has more positive affect. The learning actually goes faster when we use more easy tasks. Again, this is sometimes a little bit counterintuitive. Our children are behind. Shouldn't I be packing in the hard stuff? No, you shouldn't. You should be packing in the easy stuff to motivate him to learn, and then put in the hard things when you have that momentum. Okay. So again, the fact of doing a lot of easy tasks actually decreases avoidance and disruptive behavior, because they are actually getting reinforced and they know what they have to do to get the reinforcer. It is really important to know the child and his skill level. It is important to, again, follow the child's lead and start with maintenance tasks to warm up. And we will vary the ratio along the day and along the session, depending on motivation, right? So let's say if if your child is really tired, his motivation is low, then we will do a lot of maintenance tasks and very few acquisition tasks. But if we have really high motivation and energy, we'll just do some maintenance tasks, but more acquisition tasks, right? Again, we're going to be flexible. This variation is going to be dynamic depending on the child's individual needs, on the child's motivation and the context. Like I said, it is harder to do it with peers or to do it maybe at grandma's house for the first time. And also depending on the saliency of the reinforcer. So here I have the picture of an iPad that can be a little bit polemic sometimes. We don't know when we can use it, right, with PRT, because some kids, once they get it, they get really frustrated if we want to gain shared control. But with many kids, actually, again, if you make sure that the first time you prompt, it's really easy and he gets it right away, something like pausing and saying play, child says play, you hit play. And then they get the reinforcer right away. They saw that it was easy. And then we can actually start doing more complex things with something that's so reinforcing, like watching the child's favorite video. So again, working with a kid the other day, first, I told mom, this is his first time, said, okay, make it super easy. Just hit pause and say play. It says play, he got play. Again, this child is combining multiple words. Hit pause again. Child, without even a prompt, he said play. Really quickly, mom hit play. So I told mom, okay, we're going to have to be quicker than him now. So she hit pause and asked him a question. What's this? And he said train, because he was watching trains. Then she hit play. And that's how we could actually start introducing harder questions. Again, the reinforcer was so high that we were able to get away with doing 3 easy and 1 hard. So the ratio was was pretty low there because the reinforcer was so high. And again, it was easy enough for him to really get reinforced right away. And last but not least, the other motivational variable related to the reinforcer is that we want to reinforce attempts. Because again, let's remember that social communication is much harder for children on the autism spectrum than for typically developing children. This is why we're setting up the learning in this way. So we need to consider the effort even a simple response might take. So it might be, if we're talking about kids with initial verbal skills, just a sound can be reinforced. I was working with a little boy that just had initial sounds, and for rock, he would say rah, and that's what we would reinforce. We were reinforcing his attempt because this is where he was at his skill level, and just responding was really a great effort. We want to reinforce their attempt to make sure that they keep trying, okay? Again, practice is more important than perfection. And if they fail repeatedly, and if we set the bar too high, then this frustration can decrease, can deplete their motivation, right? So, and if again, we're not reinforcing attempts, then they learn that their response is not connected to the outcome. This is related to the concept of learned helplessness that we actually talk about in autism, which is that many times children have had the experience of not being successful, so they stop trying. We actually want to correct this by using these motivational components. We want to show them that each time they try, they will get reinforced. This is very important, again, to promote learning, to promote positive affect, and promote their actually engagement in these learning opportunities. Okay. Again, reinforcing attempts increases their motivation to respond and prevents them from giving up. And it increases, again, responses as well as positive emotions. And we have what's called a loose shaping contingency. So the fact that one day your child said bubble doesn't mean that that's where the bar is at. If tomorrow, because it's early in the morning and he's lower energy, he says baba, I will still reinforce that attempt. And again, how will I decide this is a good enough attempt for him? We will look at these things. Is your child paying attention? Is he really trying to respond? Is this attempt related to the task? And is it a reasonable effort and quality for that child in that situation? Again, even though he said bubble yesterday and was super excited because it was the first time he said it so in such an articulate way, if tomorrow he says baba, then I'm still going to reinforce that attempt because I see he was paying attention. He was really trying to respond. It was related to the task. And we know that when they're highly motivated, we will expect more. But when motivation is low or energy is low, we're going to reinforce a more simple attempt, because it's always better to provide reinforcer for their effort than to actually want to reinforce perfection. It also allows a child opportunities for success and therefore reinforcement for trying. And again, this is the little boy, an example of the little boy I was working with that really, again, was not very much into toys. Luckily, again, we were doing telehealth, so he was at home. He had his favorite rocking chair. And again, for rocking, he said rah, rah, and that's what we were reinforcing. And he also had a swing that he really liked, again, all sensory play. And he said for swing, he had the initial sound. So we were reinforcing these attempts, and we knew that these two really highly preferred activities already had their specific sound. But for the rest of the things, he actually had a go-to sound, which also happens a lot with kids when they're starting to talk. He had a go-to sound that was wah wah for everything else. And that was fine. We were reinforcing wah wah when he wanted the car, or when he wanted actually to play with water in the tub, which actually did have a nice similarity, but he was saying wah wah for, lots of things that maybe had for opening the door. He was saying wah wah, and that's fine. We were going to start shaping eventually, but the things that were highly motivating for him did have their specific sounds. But again, the rest, we were reinforcing his attempt to just respond verbally to our prompts. Even though mom was prompting open and he was saying, wow, wow, we are still reinforcing it because that's where he was at that point. And we were reinforcing the fact that he was trying to respond verbally. Okay, so now I'll pass it to Catherine that can keep giving you some examples of how to create opportunities in the natural environment, making sure you always have these 6 motivational variables in mind.
Thank you, Estefania. So I think for the sake of time, I'm just going to briefly introduce this so that we can get to some questions before we wrap up. But with everything that's kind of been mentioned so far with our ABCs and our motivational strategies, we also like to think about how we can apply these in the natural environment. So not just directly related to play. So with everything that we've kind of compiled and presented today, we like to recommend to parents to identify those routines that you do multiple times a day and observing your child to notice if there's anything motivating in these routines that we could use PRT with. And then we also are emphasizing doing things a little differently, forgetting to put the milk in the cereal, and not always acting to jump in and help the child when putting their shoes on. This is a great opportunity for us to prompt help or shoes on. So just for the sake of time, Dr. Zangu, I can let you take it away for our wrap up so we can get into our questions.
Great, thank you so much. And you can see here, yeah, we're flashing a couple of slides here. Here are some take-home messages to end on. So as you've heard, you can do PRT basically anywhere with anything the child is interested in. And I hope that we've persuaded you today that accounting for motivation during teaching interactions is really important. So if you're able to use these techniques to create as many natural and contingent learning opportunities throughout a child's day as possible, that's great. And if you can be contingent, be ready to follow through if you place a demand, that's definitely best for the child's learning. But one opportunity is better than none. So no reason to feel overwhelmed by thinking you have to do this all the time. If you can find something the child's interested in, prompt them to practice communicating, and then as soon as they try, reward that attempt, that's worth a lot. Moving to the next slide. I just want to briefly acknowledge Dr. Hardin and our collaborators on some of the research that I presented, Tom Fraser and Jennifer Phillips, who are pictured here, and our colleagues Mendy Manharas and Lynn and Bob Cagle, Dan Abrams. And we have a picture of us, a very small set of our group, of our large research team pictured here. So thank you very much for attending today. And we've been trying to answer some of the questions in the Q&A already in written format. So we'll turn now to try to take a few remaining questions live. And someone can let me know, should I go ahead and read the questions, or does someone else want to moderate that?
I can read the questions.
Thank you, Donna.
Okay, so I'll start with Ukrainian questions. Child is 4.5 years. He doesn't speak. He needs a lot of repetition of words in order to say the one word. He has only one word. How can I help him to be motivated? He doesn't sit. He beats himself, runs away. How can I work on his communication?
Thank you. So probably a lot of people can relate to this question. And for a child who has very few words, the best idea is to pick something that he really wants, something that he's really interested in, and then try to get him to use that one word he has to request it. So whether it's a food item or a toy or being picked up or anything it is that he wants, get him to practice using the one word he has to request the thing he wants. And when kids are running away and hitting themselves. We want to make sure that we're focused more on what they do want to do, and not a lot of, don't put in a lot of effort trying to make them do things they don't want to do. So finding a food or a toy or an activity that they do want, and then modeling a simple word and rewarding basically any good try, any sound at all that the child makes. And gradually we can try to teach kids how to make different sounds for different items. But when a kid is really having a lot of upset, it's better to reward their attempts at first.
Okay. Another question: how do I teach a hyperlexic child to ask questions? It's the same parent who mentions that child use a carrier phrases, and she found out that it's maybe not a great idea. So,
yeah, I saw this question about hyperlexia. So this is a condition that some kids with autism have, and it's actually can be kind of a strength. So, when you heard Catherine and Maria Estefania talking about how those ABCs, how to prompt and then reinforce a child's attempts. When a child doesn't know how to read, most of the time our prompts are verbal. We would say a word, try to get them to copy the word or answer a question, and then we would reward them. When a child is hyperlexic, we can use written prompts. I think it's okay in some cases to go ahead and write down the word if the child has really good skills for reading. And like if you're trying to teach the kid to ask a question, you could write down the question that you want them to ask. But the key here is that the reward, the natural consequence, is what is going to teach the meaning of what the child said. So you'll only be able to fade that written prompt probably if the reward is very strong. So think about, if you're trying to teach the child to say, car, you want to make sure that you do it in a moment when the child really wants the car. And when you're trying to teach the child to ask a question, teach that in a moment where the child really is curious and wants to know the answer to the question. Because if the consequence is very rewarding, then the child will learn the meaning of their behavior. If they don't care what happens after, it won't be as effective.
okay, next questions. How can I motivate my 2.5-year-old child who doesn't speak and understand speech? So,
Estefania, do you want to take this one?
this is my favorite Maria Estefania.
Thank you.
A little promotions. I want to say that 2 years ago, my son was minimally verbal, and the person who helped me and taught me and helped me to navigate and all this stuff. And she's like amazing. If you like,
Thank you,
I'm not
Donna.
gonna share your email, Maria Stefania, but I have it. So my child is verbal now, and the
Yes,
big
he
thank you
is.
you have to say
Yeah.
to Maria Stefania.
Thank you, Donna. You were the biggest one helping your child to start talking. And it's all about following the child's lead, right, Donna? It's, again, a lot of observation. 2-year-olds move a lot, move quickly, and I know it can be exhausting. So have an extra cup of coffee and just take some time to observe what he's motivated by. And it can even be something, especially a 2-year-old, something like going up and down the couch, going out, getting out of their high chair, right? Look for those moments where you see that your child actually wants to do something, and look for a very, very simple word. Again, we're just doing one word, make sure it's very clear. Your child is tugging to get out of their high chair, like all the toddlers, and just say out and wait for any verbal attempt and reinforce him. This is the first thing we want to do, make that connection. And the other thing with nonverbal children is we want to give a lot of freebies. So first of all, we will just say out and take him out of the high chair. We will do that several times because he has no maintenance task right now. Everything is hard for him. So give him freebies, getting him engaged, give him stuff for free, say out and get him out several times. And then in your fourth trial, you'll actually you'll actually make the decision. Okay, I'm going to be contingent now. Just say out and wait for any sound. And that's how we start, for him to start making that connection between sounds and a positive reinforcer.
Thank you so much. We have another questions. What is the best way to teach self-advocacy? On one hand, we want him to tolerate being said no without tantrum. On the other hand, we want to give him enough speech to be able to negotiate for himself.
Absolutely. This is a really important dilemma that we have. You know, early on when a child is young and first learning, it's probably best to prioritize giving the child enough speech, to prioritize teaching them how to communicate and to communicate about the things that they care about. It's often a second step later on to teach a child to tolerate when we say no. Young kids are not very good at this anyway, even if they don't have autism. And the problem that we face is that if we don't teach the child how to communicate calmly, then they will continue with the tantrums, even in situations where they could, in theory, have what they want. So our advice would typically be to start by teaching the communication. And then once the child's communication skills are strong, then they can be taught to wait briefly or tolerate, small instances of disappointment.
Thank you so much.
Very
Another
good.
question.
I think we're running out of time. I don't know. We should probably thank everyone. And I know that we had discussed maybe doing a PRT part 2 based on the question that we have, and still there is some material that can be presented, so we can discuss that. And hopefully we will schedule one in the next few weeks. But for now, I want to thank Dr. Jangu, Stefania, and Katrin for your contribution today. We appreciate your efforts, and it looks like we're going to be seeing you again soon here. Thank you, and thank you for everyone who attended, and thank you for all your questions. And the translation into Ukrainian and Russian will hopefully be posted in the next few days. Very good.
Everybody who's writing interpretation, please send me all your videos.
Very good. Okay. Thank you, and see you next time. And please check our website for the upcoming lectures. There is one next week on problem behaviors that Devin White, our BCBA, will be leading. Thank you.
all.
Okay.